demography and population research within Pakistan and some international experts. Today, we are lucky to have one of the most prolific researchers in the field of demography, public health, and population research in Punjab and Pakistan, Dr. Rubeena Zakar. Before I formally introduce her, I will invite Madam San Fatma to please communicate the netiquettes for the event to you all.
Good afternoon, everybody. My name is Zain Fatma, and I'm an administrative assistant at PRC. Before starting the session, I would like to request all of you to please mention your department's name on your Zoom profile. Students are requested to rename themselves as department name, their roll number, and please mention your full name. If somebody has not mentioned their name like this before joining the session, please rename yourself. All the participants except host and co-host will be muted throughout the session and will only be allowed to speak in question answer session upon request. Students are invited to ask questions in question answer session. Please raise your hands or leave a question in the comment section so that experts can answer all of your questions only one by one. Last one is that the session will be recorded. Now I would like to request Dr. Vikas to please welcome our guest, Dr. Rubeena Zakar.
Looking at Dr. Rubeena Zakar's record, I have very little space to fill in a lot of achievements. So I'm just going to read a brief bio of Dr. Rubeena Zakar. She is currently Professor of Public Health and Director of Institute of Social and Cultural Studies at the University of Punjab, Lahore, Pakistan. She has earned her Bachelor of Medicine and Bachelor of Surgery from Sindh Medical College, Karachi University, and Masters in Population Sciences from Punjab University in 2006 and Ph.D. in Public Health from Bielefeld University, Germany in 2012 with distinction. She was also associated as research in the Department of Public Health and Medicine, Bielefeld University, Germany from 2006 to 2012 to investigate violence against women as a challenge for global women's rights. Currently, she is selected for International FAIMER Institute Fellowship from USA. Her research interests include gender-based violence, women's health in developing countries, maternal and child health, inequalities in healthcare utilization, health and human rights, and gender in development. She has published more than 115 papers in international highly reputed journals like International Journal of Gynaecology, BMC Public Health, Iranian Journal of Public Health, International Journal Environmental Research in Public Health, Maternal and Child Health Journal. She is also a reviewer of impact factor journals like Canadian Journal of Behavioural Sciences, Journal of Family and Violence, Frontiers in Public Health, and British Journal of Gynaecology. Currently, she's in the editorial board of many international flagship journals, such as she is working as Section Editor PLOS One, Associate Editor BMC Public Health, and Academic Editor PLOS Global Health. Dr. Rubeena Zakar has also various operational research projects in her credit, as well as with international and national organizations like USAID, OPM, Thresher Fund USA, UNICEF and OXFAM. It is our absolute honor that Dr. Rubeena Zakar has joined us today as a keynote speaker. The topic of her presentation today will be evaluation of maternal and child week program findings from Pakistan. So without further ado, I invite Dr. Rubeena to please turn on her mic and begin her talk. Over to you, Madam. And Dr. Rubeena, you should be able to share your screen with us if you have a presentation.
Okay. Kindly allow me to share my screen.
Yes, you can, madam. You're already a co-host. You can do it.
But on my side, it's host disabled participant screen sharing. So I could not share it.
Ilsa, could you please help?
Yes, ma'am. You can check now.
Yes.
Yes, ma'am. We can see your screen now.
So, first of all, thank you very much, Dr. Vakas and AFSI College for inviting me to talk about this very important issue. So, when Dr. Vakas invited me and asked for asked to share some of any research related to maternal and child health, then I decided to share my very important research, which we have conducted with the technical and financial support of UNICEF. So this was related to evaluation of maternal and child week. And I thought it's a good idea because most of the audience are young students. So I would like to share that how young people, they can be involved in evaluation research. So because this was the one examples which we have engaged our young students in the evaluation process of maternal and child health program. So my acknowledgement that UNICEF, because they provided us financial and technical support, and especially Dr. Musarat Yusuf, she was with us at each and every step when we were conducting this research, and the whole team from different provinces, they also support us and coordinated well throughout the process of this research. So what is the background of maternal and child health program? Because as you know, Pakistan being a developing country, still we have our social indicators which are little below as compared to the other countries, especially with respect to maternal and child health. And but a lot of programs are going on from United Nations and from WHO, from UNICEF, to improve maternal and child health. Especially UNICEF is playing a great role for improving maternal and child health. Especially they have started a maternal and child week strategy to help the government in delivering the services for maternal and child health at the doorstep of the communities. Because as you know, still in Pakistan, maternal mortality ratio is high as compared to other developing countries. After Afghanistan, in South Asia, Pakistan's maternal mortality ratio is very high, which is around 140 maternal deaths out of 100,000 live births. So still we have to achieve a lot to reduce maternal mortality. Here I want to share that how young champions can play their role to achieve sustainable development goals. So it's very, very important that we engage our young people in realization of sustainable development goals in achieving these goals. At my department, I have displayed a big wall where we have presented all the 17 SDG goals with different indicators. So our students, they know every time when they are passing from this corridor, they know about these goals, and they have to think about that how they can achieve these goals. As the young people, they are the agent for transforming their communities, and young people, they are driving force for the development, but only it can be possible that if we provide them with the skills and the opportunities to reach their potential. So young people, they have a lot of potential, but we have to see that how we can build their capacities so they can play their role in achieving these sustainable development goals. Because a lot of programs are going on in Pakistan to achieve the sustainable development goals, And when these programs are going on, it is very important that these programs should be evaluated. So we can see that at what level they have achieved their objectives. So in localizing and implementing sustainable development goal, evaluation is very vital to address the complexities of sustainable development goals. And country must build evidence for the value and effectiveness of the policies and programs and strategies. As you know, that our research should be evidence-based, and it is only evidence-based if we regularly do research on these very pertinent topics. So UNICEF has actively supported in increasing the capacity to generate and manage and utilize data and evidence for monitoring and evaluation of sustainable development goals. One of the example is that UNICEF provided support in evaluation of maternal and child week in Pakistan with the aim to improve maternal and child health, especially in those areas which are hard to reach, where the services are not easily available. So, because this is one of the on the one side, these evaluation will help to improve the program performance, because if you are doing the evaluation of the program, then you can say that how much the objectives of the programs have been achieved. Otherwise, if there is no evaluation, how do you know that at what level the program has achieved the objectives? So that's why evaluation of the program is very, very vital. To know about at what level they have achieved the objectives, and to know about the performance of the program, to know about the contribution, that how much this program has played their role in achieving in solving the social issues. So on the one hand, it provides, it can lead to the performance of the program, but on the other hand, it can contribute to learning how to conduct and manage program evaluation through the evaluation team. So this is always the win-win situation. Because I know many of the students might be they don't know about what is MCW, what is Maternal and Child Health Week. So I want to tell you a little about the history of Maternal and Child Health Week, because this project was launched in 2007 as a pilot project, and only in the 3 districts of Punjab at the first step. And it was definitely a launch with the help of financial support of UNICEF. And after 2007, after the pilot project, they found that it is very successful. They scaled up this pilot project to 6 other districts of the Punjab, and in 1 district of KPK, Sindh and Balochistan. In 2009, MCW program, it was extended to 29 districts of the country, including the 9 districts from the Punjab and 11 from the Sindh, and 3 districts from the Balochistan, and 4 from KPK and 2 from AJK. So in 2009, in all over Pakistan, the MCW program was initiated. And in 2012, MCW initiative was scaled up to national level by the Ministry of Health, because at the initial level it was conducted by UNICEF, but in 2012 this program was handed over to Ministry of Health, and then it was under the control of Ministry of Health. So this Maternal Child Week program, what was the purpose of that program, and what were the component of the MCW? One of the components was immunization for children less than 2 years age, and the second was tetanus toxoid vaccination, which is called TT vaccination for all the pregnant women, and deworming, because you know under 5 children we have a lot of problem related to worming. So it was important, because many of the time children, they have anemia, and then after many years doctors or the healthcare providers, they find that child has the problem of worms. So that's why it was decided that in under 5 children, deworming should be provided. And this deworming was for 2 to 5 days children. And the other major components of Maternal Child Week was creating health awareness among families, among parents, among mothers. So this was the objective of Maternal Child Health Week program. And now I want to tell you what was the objective of our evaluation research. Actually, we want to know that to what extent Maternal Child Health Week implementation followed, because they have some intended plans. So we want to see at what extent this program followed the intended plan, and we wanted to analyze the synchronization between the national, provincial, and priority, that if it is considered relevant to our national program, and it is also relevant to our provincial needs. So we want to see this. And we want to assess the extent to which the Maternal Child Health Week met the basic health needs and rights of women, girls, and boys, and because they have some intended objectives. So we want to see it with the perspective of beneficiaries, because beneficiaries were the families. So we want to see it that how much beneficiaries of this project, they are satisfied with it. So one of the objectives were to determine the extent to which Maternal Child Health Week helped to mobilize communities to utilize and strengthen routine health services. And we wanted to explore the extent to which the Maternal Child Health Week addressed the needs of marginalized and especially in those areas where their services are not available. One of the objectives was to provide the cost analysis of the intervention, and as well as identify the lesson learned and exploring what has worked well and what was not worked out. So this is the main objective of the evaluation. When you are doing evaluation research, you want to see that what lesson you have learned and what worked well and what not. So you want to see it. So that's why you want to improve the intervention on the basis of your findings, and then the intervention continue. As well as we want to see that sustainability of maternal child health. Because most of the time interventions have started, but there is lack of sustainability. We don't know that the project will be sustainable or not, and after when the funding will be finished, then how the project will survive. So it is very important to see the sustainability issues of the project. So on the basis of all these, we provided a lot of recommendations to the government to strengthen and improve maternal and child health. And this program is still going on. If you know that this program is started 2 times in a year, because there are 2 major killers of under 5 children. One disease is diarrhea and the other is pneumonia, because pneumonia is in winter season and diarrhea is in summer season. So during the summer season, the Child Health Week is started during the month of April and May. So there are 2 weeks in a year. 1 week in the summer season and the other is in the winter season. So before the start of increased cases of diarrhea, the 1 week maternal health week is provided in all the districts which I have mentioned throughout Pakistan, and mothers and families, they are trained that how they can take care of how they can prevent diarrhea cases among children, and if they have diarrhea among children, such type of cases, how they can treat them, and what they know about when they have to contact doctor and what are the dangerous signs. So the mothers, they are aware, make aware about these things, and they are trained about such issues. So there should be less morbidity and mortality among under 5 children. And similarly, during winter season, our children, they have a lot of problems with respect to pneumonia. So during the month of December, there are a lot of cases of pneumonia. So that's why the program is 1 week education and health awareness is provided before in October, before the surge of these cases. So these, because of these 2 weeks, a lot of mothers, they are trained, and this is not only health awareness, immunization, tetanus toxoid for women, and nutrition, and all the components which can be, which can improve the health status of children and women, they are included. So the scope of evaluation, it was all over Pakistan, and this was a countrywide evaluation which covered almost all of the areas where the maternal child leave was implemented. And we included 4 provinces and 3 regions, which included FATA, Gilgit-Baltistan, and AJK, and Islamabad as well. So evaluation assessed various aspects of implementation of maternal and child health week over the last 10 years, because it was started in 2007, and we have conducted this evaluation in 2018. So we included the time period from 2007 till 2017. Definitely, when you are doing any evaluation, you have to use some criteria on the basis of you are doing this research, this evaluation. So for evaluation of maternal and child week, we have included OECD DAC criteria, which is called Organization of Economic and Cooperation and Development, Development Assistance Committee's criteria. And I will share with you what was that criteria. So this criteria included relevance of the program. It also see the effectiveness of the program, efficiency of the program, sustainability, and the impact of the program. So these were the criteria which we used to assess the MCW program. So because the evaluation measures the criterion of impact as long-term outcome, and it was not intended as an experimental or impact evaluation, because we did not conduct experimental research. We did a cross-sectional research. So on the basis of cross-sectional research, it is always difficult to have a long-term, to see the long-term outcome. So that's why I have mentioned that we measure the impact, but not the long-term. But what was the new innovation of our evaluation? That in addition to all these criteria, we also see the cross-cutting issues, such as equity, such as gender, and human rights. These were also, we tried to see all these issues when we were conducting evaluation of maternal and child health. So I will share with you the findings, so you know that how we have addressed these. A little bit about methodology. We use analytical approach of contribution analysis, and definitely it was a mixed method approach we used, and we collected both qualitative and quantitative data. If you talk about the quantitative data, definitely conducted quantitative study with beneficiaries, with women, because mothers, they were the beneficiaries, they were closely engaged in it. So we conducted a beneficiaries survey, and the main purpose of beneficiary survey was to assess the coverage of maternal child leave and to examine mothers' knowledge, attitude, and practices regarding the different maternal and child health issues. We conducted a quantitative study with lady health workers, because lady health workers, these are the main stakeholder for maternal and child health. Because lady health workers, they are the community health providers, and they were very closely involved in maternal child health. So the purpose of conducting quantitative study with lady health workers was to assess the lady health workers' knowledge and attitude and practices regarding different maternal and child issues, and their experience of imparting awareness sessions to mothers during maternal child leave, because they are living in the same community, and being the community member, they have a lot of say in the community. And So that's why in the maternal child health week strategy, lady health workers, they were involved, and they provided the health session to women, and they are already trained in it, but during the before the sessions of maternal and child week, they are trained more in providing such kind of sessions to women. We conducted qualitative study, especially the focus group discussion, key informant interviews, and case studies. So focus group discussions we have conducted with the lady health workers, and key informant interviews we have conducted with the management of maternal child week, and we have conducted case studies with different women beneficiaries. So case studies, what was the purpose of case studies? The main purpose was to explore the success and the failure and the positive and negative experience of programs' potential beneficiaries. Because for the case studies, we took the cases who are very, who have a positive impact on their lives because of being the part of maternal and child health week program. And at the same time, we also took cases which who did not attend who were not the part of maternal and child week, and but they found that it was their failure and they have a negative impact on their lives, but because they were not part of that maternal and child health. So the basic purpose of case studies were to explore such kind of cases. For cost benefit analysis, we did descriptive cost analysis. As I already told you that this study was conducted both quantitatively and qualitatively. For quantitative studies, potential beneficiaries were women of reproductive age, having at least one child of age less than 5 years preceding the survey, because we did not include those women who are married, but did not have any child, because this program mainly focused on child health. So this was the reason for the selection of those women. And for the stakeholders, this was limited to most relevant informants at the federal level, at the provincial level, and at the district level. At the federal level, we conducted qualitative interviews with Directorate General Health, DG Health, and National Auditor, Chief Health UNICEF, National Program Manager, Maternal and Child Health, Program Manager, National Program Manager of Expanded Program on Immunization, because immunization was one of the components of maternal and child health week, so they were also involved in the study. At the provincial level, DG Health Services, Provincial Coordinator of Lady Health Work Program, because Lady Health Worker, they were the main stakeholder in it, and we wanted to know from their bosses, like from the provincial coordinators of Lady Health Worker Program, about this MCW initiative, that how they involved Lady Health Worker Program, how they trained them. So that's why we conducted some interviews with Provincial Coordinator of Lady Health Worker Program, as well as Provincial Coordinator of EPI Program, and Provincial Health Specialist UNICEF, and Coordinator of MNCH Program. At the district level, we conducted interviews with the district health officers, with the district coordinator of Lady Health Worker, as well as NGOs working in the area, especially working on maternal and child health issues, and community health workers, who were the lady health workers, and lady health supervisors and vaccinators. So we conducted qualitative interviews with lady health workers, with lady health supervisors, because 10 lady health workers, they are supervised by one lady health supervisor. So that's why we conducted interviews with lady health supervisors, especially the focus group discussions, and vaccinators. So this I already explained, that what was the methodology. So if you talk about the sampling, I just want to show you the table. Overall, for quantitative interviews, we have 1,540 sample size from from 4 provinces and 3 regions. And for key informant interviews, we conducted 172 KAIs, and lady health workers. We conducted survey with 220 lady health workers all over Pakistan. 66 focus group discussions, and case studies were 22. So a little bit about the findings. Here I'm going to share only the key findings, because as you know, I explained earlier that we conducted the evaluation by following the DAC criteria, and according to the DAC criteria, we want to see that is this intervention was relevant. So we checked the relevance of MCW, and we found that maternal child peak strategy was devised to assist government health departments to effectively utilize the existing network of lady health worker and EPIs. Because as you know, we are not going to, according to, under this MCW program, they did not start new initiative. They utilize the existing network of lady health workers and expanded program of immunization. And although the initiative was new, but they utilized the existing network. So Maternal Child Week was aligned with the health priorities and health policies of all the districts, all the provinces, and at the federal level. Maternal Child Health Week was highly relevant to the national and provincial health strategies and plans to achieve improved maternal and child health indicators, because the main purpose was at the end outcome is improved maternal and child health. Maternal Child Health Week was designed to cater to the health and needs of the general community, as well as the marginalized and vulnerable population, because one of the components was to reach to the marginalized population, to reach to the vulnerable population who have no access to other kind of healthcare services. So overall, 78.5% mothers reported to get benefited from the activities of Maternal and Child Week. So Maternal and Child Week events were organized biannually after careful analysis of the existing situation of maternal and child health indicators at the district level, at the community level, and consultation with the concerned health authorities. So the survey which we conducted with the beneficiaries, we conducted survey with those who benefited with the services, and we also included those women who were not benefited from the MCW initiative. There were some cases because mostly they have utilized the services of Lady Health Workers program, but in some areas there were no Lady Health Worker program. But this initiative was also continued in those areas where there were not Lady Health Workers program, but they utilized the services of vaccinators in those areas. So here you can see that according to our research findings, around 78.45% mothers, they reported to get benefited from the MCW initiative, and with respect to different provinces. In AJK, 96.5%, mostly in AJK women, they benefited from these services. And in Punjab, 93% mothers benefited from MCW activities. But in Balochistan, this percentage was low. It was 8.6%. And in Gilgit-Baltistan, it was 43.9%. Lady Health Worker was the most significant source of information regarding the upcoming round of Maternal and Child Week, because we asked them that how did they know about the next session of the MCW. So most of the women, they reported that they got this information from Lady Health Workers. So before the start of each round of Maternal and Child Health Week, Lady Health Worker, they announce the dates of the MCW week. So most of the women, they got information, though they also did display poster and announce at the mosque. So they use different kind of strategies to disseminate the information regarding the upcoming session of MCW. But women reported that the most important source of information for them were lady health workers. 74.5%, because this is the findings from those who participated in the survey, and 74.5% they knew about the maternal and child week. 4% of the mothers, they were using the services, but they were not aware of the term maternal and child week, because they know they use different kind of terminology for that week, because most of them, they knew about the term MCW, but some they didn't know, but they were using the services, and they call them के जो lady health workers हैं वो उनके लिए use करते हैं बाजी का word. So they बाजी का जो हफ्ता आ रहा है उसमें तो वो they use different kind of terms for MCW, because they didn't know exactly about the term of MCW. And 29.4% of the mothers, they got benefited from MCW activities first time after 2016. Although the program was launched in most of the districts in all over Pakistan in 2012, but most of the beneficiaries, they reported to use the services after 2016. And 40.2% got benefited between 2013 and 15, and 79.9% of the mothers, they reported the last maternal child health week round. It was held in their locality in 2018, because we have conducted the interviews, and most of them, they reported that they participated in the last session preceding to the our survey. They attended those sessions of MCW. We asked them that what were the driving force behind the use of MCW. So 69.2% they reported that availability of free health services was the major driving force behind participating in the MCW initiative. But 24% they reported that encouragement by the family was the driving force behind the utilization of MCW, because some of the women, they reported that if a reproductive age woman, they are using the services preceding the year, they utilize the service, then they share the good experience of utilizing this service at home, in the community with other women. So then they get the encouragement that the next time they have also participate in MCW initiative. So 24% women reported such kind of experiences. 28.5% reported that they were not informed about the MCW in advance, so they were unable to attend maternal and child week activities. And 30% of the mothers stated that they had missed any round of MCW due to unspecified reason, because they did not provide an exact reason, but they reported that they missed the case, any last some sessions of MCW. So the other criteria was effectiveness of the program, and with respect to effectiveness, overall performance of maternal and child health week was very good in achieving the intended goals according to our findings. And stakeholders acknowledged that maternal child health week had raised the knowledge of the mothers, and the effective awareness campaign by MCW had equipped the mothers with better healthcare knowledge, especially for the prevention of diarrhea and pneumonia. So the awareness also increased the number of deliveries in the hospitals, and dispelled the various cultural misconceptions about the vaccine, and encouraged the women to get tetanus toxoid shots, because this was one of the objectives of MCW initiative. With respect to other indicators of effectiveness, on-field plan was largely chalked out by the health department, whereas UNICEF by and large did budget and fiscal planning. And but most of the time the program was initiated and planned by the health department, and all the different healthcare providers, they were actively engaged in it. With respect to beneficiaries, 67.4% of the birth were attended by doctors, because these were the, we also checked the different statistics from the hospitals and health centers, and we found that during this time period, the indicators they wanted to achieve, these were significantly achieved by this. Because if you see that with respect to different health issues during 2006, because the program was started in 2007, so usually we use baseline data from 2006. And because we conducted the evaluation till 2017, so that's why we utilized the secondary data from 2018 to see that how much the indicators which the MCW initiative wanted to achieve, how much they have achieved. So analysis of Pakistan Demographic and Health Survey, it found that the number of antenatal care visits increased from 28% to 51% during this time period. And skilled birth attendant, it was also increased from 61% to 86%. And intake of iron supplements during pregnancy, it increased from 25 to 45%. And delivery by skilled birth attendant, it was also increased from 39%, 39% to 69%. And exclusive breastfeeding practices, it was also improved from 37 to 48% during 2006 to 2018. A lot of we also asked mothers about what kind of information provided by lady health workers, and they have a lot of positive experiences regarding the information provided by, because we have short of time, so I am not explaining it in detail. So here you can see that the beneficiaries, knowledge of beneficiaries and non-beneficiaries, because we have tried to compare the knowledge of those women who were the part of MCW initiative and also those women who were not part of MCW initiative. So we found that there was huge difference of knowledge among these two group of women regarding maternal and child health issues. So it also shows the success of MCW initiative. We found that mothers, they have a lot of fear regarding immunization. And after this MCW initiative, many of the fear, these were dispelled. The many myths were dispelled, and they have the accurate information. And lady health workers, they try to convince them to get immunization for their children. So it has a lot of positive impact for it. We asked them about the experiences of using new services, MCW services, and most of the women, they reported that they were very much satisfied with the services provided by the MCW initiatives. With respect to efficiency, the available human, financial resources and supplies, these were used quite efficiently. And I just want to share the quantitative findings that capacity building, one was the main objective of this initiative, and knowledge of lady health worker regarding different maternal and neonatal and child health related issues were quite good, and which reflect the capacity building benefit of maternal and child health care. Not only the capacities of lady health workers, but also mothers. So regarding deworming, because this was the one of the components which was different than the other initiative, because this is the new initiative they have included when they started MCW. So benefits of deworming tablets were told to the mothers by the lady health workers before giving them these tablets during MCW, and 80% of the mothers, they reported to receive deworming. And but the percentage was different in different part of Pakistan, but majority of women, they reported that it was beneficial for their children. Regarding the sustainability of Maternal Child Health Week, the key informant consented for the continuation of the CW benefits for the beneficiaries after the termination of the sponsorship from UNICEF. And they shared that it can be only possible if it is part of our ongoing health department's activities. And good news is that now Maternal and Child Week is a regular part of our healthcare department at each province. So this initiative was sustainable. With respect to long-term impact, as I shared earlier, that Maternal Health Week, it has achieved a lot of objective which was planned, and it provided an effective approach for improving maternal and child health indicator. It strengthened the service delivery system. It raised the awareness of communities through utilizing the existing network of lady health workers. It also strengthened the capabilities of lady health workers as well. So with respect to cross-cutting issues, Maternal and Child Health Week did not address the cross-cutting issues such as gender, disaster risk, and security, because we want to see that how this initiative has taken care of cross-cutting issues. So with respect to gender, most of the time they have engaged mothers, but involvement of father is also very important. So planning of the program and activities did not count for engaging and raising the awareness of males. So they should, because this was one of our recommendations, that males should be engaged, father should be engaged in the program to get more benefit of that program, to achieve their objective very quickly. So in Gilgit-Baltistan, males also participated in health sessions as they were directly connected and correlated with mother and child health. So we found that in Gilgit-Baltistan, they had a lot of males, they were part of these sessions, but not in other areas. So with respect to the disaster affected areas that remained unaddressed and not prioritized in the CW, except FATA and Gilgit-Baltistan, where the key representative illustrated that efforts were made to cover the disaster affected areas. In most of the religious leaders, they did not support such perceptions and have positive opinion about the vaccination. The one good thing was that in those areas where there are a lot of misconception about the vaccination and the maternal and child health issues, they involved the religious leader, especially in Peshawar. They involved very well. They involved the religious leaders, and they played a very positive role to encourage women to be part of maternal and child health program. So in this whole evaluation, we have used theory of change, and we use the theory of change model, which explained that how and why a desired change is expected to happen in a particular context. So Maternal and Child Health Week is a targeted activity to introduce a desirable behavioral change in society in the domain of mother and child health. Because if you see, it's not very clear, but here you can see that when you study theory of change model, you have some inputs, you have activities, you have outputs and immediate outcomes and long-term outcomes. So when we see our evaluation with respect to MCW, so what were the inputs? Because our inputs with respect to resources, with technical assistance, with the management, you can see here, the resources included human resources, financial resources, and the supplies. And technical assistance were the training of lady health supervisors and lady health workers, and the management related to coordination and partnership with the organizations, non-governmental organizations, and the leadership. So these were the management related inputs. So what kind of activities, as I explained earlier, that activities included the social mobilization, wherein they provided awareness walk, announcement at the mosque and school about the MCW initiative. Street announcements were also made, and electronic media campaigns on TV and radio, on print media was also utilized. Word of mouth was the main source of information that it was transmitted, the information was disseminated from LHWs, and door-to-door invitation by the community health workers. So these were the social mobilization component of MCW was very strong. So these were the activities, and with respect to procurement and distribution of required medicine and supplies, this was also one of the components and activities of MCW. So intervention included immunization of under 2 children, because they identify those cases who are the missed cases. Because, you know, we have EPI program, regular program, and we have campaigns related to measles and with respect to polio. But this was other than that those cases who were missed during that season sessions, they were identified and they were provided the vaccination during these 2 weeks. So that's why the immunization of under 2 children, this is one of the components of MCW intervention. Deworming of under 5 children, which were from 2 years to 5 years, and tetanus toxoid vaccination of mothers, pregnant mothers. And one of the other main components was health awareness. Health awareness regarding the exclusive breastfeeding, complementary feeding, antenatal care, postnatal care, vaccination, regarding the pneumonia and diarrhea, symptoms, treatment, prevention. So all were part of activities of MCW. When you see the output, so the output were cost-effective and accessible healthcare services, because at the grassroots level, these services were provided door to door at their doorstep, and especially they try to involve the marginalized section, but still many of these marginalized sections, they were not covered, and we provided some recommendation that how they can be included further. In some areas they have involved them very well, but in some areas not. So we provided the recommendation. And with respect to cost effectiveness, biannual door-to-door healthcare services, these were very effective to achieve maternal and child health related indicators. With respect to immediate outcome, enhanced maternal and child health utilization, which according to our findings, we saw that they achieved it. And with respect to improved knowledge, attitude, practices regarding maternal and child health, and these were the immediate outcomes, and strengthening of working of healthcare services. Because every time healthcare providers, healthcare system, healthcare department, they are going through such kind of providing such kind of services. And many of the healthcare providers, they shared that from every round of MCW, they have learned new things. And they have learned that how they can manage well the next round of MCW. And definitely the long-term outcome were improved indicators with respect to maternal and child health. So if I concluded, maternal and child health week was very effective in providing the maternal and child health services to the targeted population. And some of the regions, they have provided better results. Some regions not very well, but they are doing great. Because if you see after 2018 to 22, they have their indicators are further improved. And however, MCW has the potential of increasing the coverage by enhancing the community participation through the community mobilization. Because if the community is mobilized, then they can achieve a lot of objectives. So, we had some suggestions that MCW can be further improved by effective participation, timely provision of logistics, and by enhancing the financial incentive for the field team. So throughout, as at the start, I talked about engaging young people in evaluation. So we have very good experience because we have engaged our young students in the evaluation process. Throughout the process, our many young students, they participated actively in the design phase. They were involved in carrying out the field research. They were involved in the analysis. They were involved in interpretation, in documentation of the results. They were actively engaged. So this whole process has provided them opportunity how to conduct evaluation research, as well as it trained them
Rubeena, we can't hear you.
Sir, I think the internet
She's got-
issue. Internet
I think
issue.
she's been disconnected, yes.
Yes.
Ladies and gentlemen, we're going to wait a minute or two for Dr. Rubeena to rejoin.
Okay. Okay.
sorry, G disconnected.
Welcome back, madam. No problem.
So this is just only the last slide. So what is the benefit of engaging them? We found that young people, they have good listening skills and respectful and know how to establish rapport with a variety of audience, and they are open to criticism and even grateful for identifying their mistakes. So we were very happy to work with them, and they have great experience, and maybe in future you can also interact with my students who were the part of that evaluation. So I just want to share some photographs from our, because we have conducted some consultative meetings, Islamabad at job level. So because our chief was Chief UNICEF, he was also very actively engaged in it. These are the consultative meetings in Sindh, and it's the training session at the AJK University, and training in Gilgit, Pakistan, training in Chakwal, Punjab, conducted training of field researcher at our institute, and training in Sindh. So this is some just from data collection, AJK, Balochistan, Pakistan, APK, Punjab, Sindh. So thank you so much. So if you have any question, feel free to ask.
Thank you very much, Dr. Rubeena. Dear, the floor is now open for questions. If you have a question, please raise your hand and Gilsa will unmute you. Thank you. I think I'll start off with a question that I have. I actually have a twofold question, madam. The first question is, when you were collecting data or interviewing government representatives and lady health workers, did they share any problems or impediments in the execution of the program? And secondly,
Yes.
did you, please go ahead.
Yeah, definitely they have a lot of problems because, you know, lady health workers, they are most of the time they are overburdened, and they are doing a lot of other works because they are part of community outreach program, they are part of polio campaign, measles campaign, and when there is extended program in immunization activities, they are also part of it. And after COVID, they were part of COVID vaccination as well. So they have a lot of problems they share, but at the same time, they were very happy to be part of this Maternal and Child Week because they shared a lot of stories, success stories from their communities, and they were very happy. But one thing which was positive that they were provided separate incentives, financial incentives, when they were engaged in MCW initiative. So they were not very like angry with the activities of MCW, but in general, they had problems that they are overburdened and they are not paid according to the services they are providing to the community.
Thank you very much, Dr.
So what is your next question?
The next question is, as an expert, do you feel that this analysis, since this is going to be an ongoing activity, do you think this analysis can be made or turned into?
Sorry, I could not hear you properly.
I said, since this is going to be an ongoing activity, do you think a longitudinal evaluation of this program can ever be done?
Sorry, I think my internet connection was not stable when you were talking.
Can you hear me now?
Can you repeat?
Yes, sure. What I was saying, Dr. Rubeena, was, do you think, since this is going to be an ongoing program, do you think a longitudinal analysis of this program is possible? I think my voice is not coming through.
Dr. I think they're again stuck. सबकी आवाज नहीं आ रही.
Hello. Hello, sorry, I was disconnected.
Can you hear us now, Dr. Rubeena?
Yes, yes.
My second question was that, do you think that this analysis can be done from longitudinally, or since this is going to be or is an ongoing activity, do you think a longitudinal analysis of this program is possible?
Yes, definitely, it can be possible, because if you want to see long-term impact, the effectiveness of long-term outcomes, so definitely you have to do longitudinal research, and it can be done because we have baseline data. Why we did not do this? Because we had baseline data from demographic and health survey, because the survey was conducted in Pakistan, all over Pakistan in 2006, and the initiative was started in 2007. So that's why we use baseline data from 2006 demographic and health survey. And in 2018, the last demographic and health survey was conducted. So that's why we utilized endline data from demographic and health survey 2018. So that's why we didn't need longitudinal studies. But definitely, if you want to see cause-effect relationship, then you need longitudinal study design.
Thank you. Does anyone else have a question? If you do have a question, please raise your hand. Otherwise, we'll conclude the proceedings. So there seem to be no questions. I would like to thank you from the bottom of my heart, Dr. Rubeena, for taking out the time and sharing this very relevant, very contemporary, and very interesting evaluation study with us. We hope that you can come back and share some of your other works with us. I would also like to thank all the participants who have taken time on this very hot day to join us in this webinar. Please watch out for more emails from PRC. We are planning to conduct another webinar early next week, and we will be honored if you could join us then. So with these words, thank you very much, and we will see you in a few weeks, inshallah. Allah Hafiz.